Good afternoon everyone. Myself Dr Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about TFCC. TFCC is triangular fibrocartilaginous complex in your wrist. So basically the pain occurs on the little finger side. It could be an overuse injury or it could be an acute injury which could result from twisting or bending activities. So usually the patient is having pain during the twisting or the bending activities, or when pressing, like for example when I want to stand up from the chair. In this position one can have the pain, or while doing the push-up one can have the pain. So during the acute phase, again the pain is severe or it could be moderate pain. So one can start with the ice pack for 15 to 20 minutes or ice massage for 5 to 6 minutes. One can also modify the aggravating activities, because these activities only will be modified by the physiotherapist. So one should go to the physiotherapist if one is having the pain on the little finger side. So physiotherapist can also suggest the wrist brace, because brace with the help of the brace one can do his or her activity of the daily living very easy. So during the acute phase one can do simple, the first exercise would be wrist extension and wrist flexion. In this way one can perform the wrist flexion extension 5 to 6 times or 8 to 10 times according to the pain of the patient. Second exercise would be one can do pronation or supination. So by maintaining the wrist in the neutral position one can do the supination and pronation, again 8 to 10 times one can do. The third, the very important exercise, that is tendon gliding exercises. So for tendon gliding exercises, the position would be like this. So one can do like this, third would be like this, and fourth would be like this. So I am repeating again, like this. First gliding would be this, second would be this, third would be this, and fourth would be like this. So these all are the tendon gliding exercises which are very important and part of the rehabilitation program in TFCC injury. Then as soon as the pain subside, one can gradually progress to the isometric exercises. So for the isometric exercises you can take the position. So by taking this position you can apply the contraction, because it is an isometric contraction. So you can apply the force just on the lateral side, not on this side, just apply force on the little finger side. So one can perform the isometric wrist extension in this way. You can perform this exercise 7 to 8 times initially, then you can progress to 10 to 15 times, and you can also increase the sets also. Next exercise would be pronation, that would be isometric pronation. So for isometric pronation, again the wrist or forearm would be in the neutral position. You can apply the isometric force like this. So in this way you can perform 5 to 6 times, then in progress to 8 to 10, 10 to 15, then you can increase the sets. So thank you.